Query number 24 from right now in Pune, but planning to shift to my hometown. That is a town, rural area in Rajasthan. So in this 7 year, right now in Pune. So in this 7 year, I had worked with first in college as tutor, then in cities like Ahmedabad and Pune in multi-speciality setup. In Pune, where I work currently, we do quality work and our charges are accordingly. Now shifting to my hometown, mostly I will start my practice by next year, March. I'm expecting my second child. Congratulations. I've done market research there. It's basically rural area dentist charges like 2,500 to 3,000 for RCT. Extraction charges are 300 to 500. Composite, they do hardly in 500 to 800. I had decided I won't compromise on my quality and charges. I'm planning to keep my RCT charges 4,000 and composite at least 1,500 to 1,800. Just to give you an idea, I don't know how I will do my execution. In rural area, people come seeing rates mostly. Awareness is still very low. Please do give your suggestion. See, in your whole problem, you have given the solution yourself in the second last line, or rather the last line. Awareness is still very low. So the simple answer is create awareness. Everybody is knowing the fact. When patients ask me certain times, ये चीज इतनी महंगी क्यों है, इतनी ये क्यों है, आप महंगे हो, ये सस्ता है, ये महंगा है, वो सस्ता है. And there is nothing called as cheap or expensive in today's world. You get what you pay for. आपको 500 की भी चीज मिल जाएगी, आपको 10,000 में भी वही चीज मिलेगी. आपको 5 रुपए का चाय का कप भी मिल जाएगा, जबकि स्टैंडर्ड 10-12 रुपए का मिलता है इस वक्त. फिर भी 5 का मिल जाएगा, और आपको 150 रुपए 200 रुपए की भी चाय मिलेगी. So the choice is yours, what you want. So the question is not about I plan to keep my charges. The first thing is I should plan to calculate my costing first. That should decide your charges, not what you planned to think. मैं composite का इतना चार्ज करूंगी, मैं RCT का इतना. Don't give me an idea. If you're having pregnancy right now, you're expecting your child, congratulations. Please do work out your costing part. I'm sure you will be pretty much aware कि आपको कौन से materials use करने या use करते हैं आप for this procedure or for that. You know the costing of those materials now. Work that out. Use my costing videos as a help. Search profitable or profitability. On my YouTube channel, you get the costing videos. 1 video concise or 5 video series. Just look out for that and work out what will help you. Accordingly, keep a NPM of 50%. That should be your starting charge, not that whatever you plan to keep in your mind. So shun that thought of what you plan to keep rather than what you should keep. I feel in big cities, mostly Pune, Ahmedabad, there is culture of working late night till odd hours, which is the main reason many lot of female do not practice, and their family life suffers a lot, especially kids, if they don't have family support. Any advice for female regarding this? See, there are people in my town who have a good footfall, not dentists, otherwise service industry or goods industry, product industry also. I know them, they are, you can say, having very good footfall, very good business. But I know them since almost 15 plus years now. Some of them, they shut down their shop at 5 p.m. and their patients are adjusted to it. I last year in July shifted my clinic timing from 8 p.m. to 7 p.m. in the evening. My daughter was in 10th at that time. Now she's in +1. I wanted to give some time to her. So simply put, the logic was very clear for me. Priority was set. One of the colleagues asked me, "Sir, did your patients accept?" Well, it is not their problem. It is not my problem whether they accept it or not. They have to adjust as per what I want in my life. Simple logic. We prepared a ground for it. We made the patients, we can say, clear about this thing 6 months in advance. That we'll be changing time from 1st July. We'll be changing time for 1st July. In those 6 months, patients had actually adjusted mentally to that. A few did not. A couple of patients on Saturday, this Saturday, 2 days back, asked me, I came to you couple of months back. You were there till 8. Now you close at 7. I said, look at the notice. What is the date? With effect from 1st July 2022. You still say that you came 2 months before. हाँ, मैं पिछली अप्रैल में आया था आपके पास. That is 1.5 years back, not 2 months back. Okay, तो हमने आपको बताया होगा, शायद मैं भूल गया. Okay, no problem. This is the new time. Some patients ask me, मैं सुबह 8:30 फैक्ट्री चले जाता हूँ, रात को 9 बजे आता हूँ. संडे मेरी छुट्टी होती है, आप करेंगे? मैं कहा, I can adjust you maybe once, only 2 if you have an emergency. But you expect me to work every Sunday on you just because you are not ready to adjust your time? नहीं डॉक्टर साहब, काम थोड़ा छोड़ देंगे. मैंने asked him a question. Sir, please don't mind me asking. कोई आपकी नियर फैमिली में कोई मिसहैप हो जाता है, कुछ हो जाता है, तब आप क्या करते हैं? डॉक्टर साहब, दुख सुख में तो जाना ही पड़ता है ना. ओके, तो यू क्लोज योर फैक्ट्री? नो नो नो, काम चलता रहता, मैं नहीं जाता हूं, कोई ना कोई चले जाता है मेरी जगह पे. ओके, कल को आपके दांत में भयंकर दर्द हुआ, भगवान ना करे, स्वेलिंग आ गई बिकॉज ऑफ योर ऑलरेडी एग्जिस्टिंग प्रॉब्लम्स, व्हाट आर यू गोइंग टू डू? डॉक्टर साहब, पेन किलर खा के गुजारा कर लेंगे, आप टाइम तो देते नहीं हो. तो सुबह 8:30 से पहले और रात को 9 बजे के बाद आपको टाइम देने वाले मेरे शहर में बहुत कम मिले. हार्डली काउंटेबल पीपल. Whether they'll be offering you worthy treatment or not, that is not my decision. So if you are not interested in saving your teeth or interested in your health, how can I help you? The simple logic is, for you, is coming back to your query, late night practice or early evening practice. Rural areas, I just answered to the Mohali query. Rural areas have that advantage. Start early, finish early. That is the biggest boon of a rural area. Rural area people sleep by 7:30 or 8 p.m. Cities थोड़ा ना, cities तो शुरू होती है रात के 8 बजे, 2 बजे लोग सोते हैं. That is the logic. So query, so I believe that you got the answer. If you believe that working till late night is the solution, it's not. It's not.